Board encourages and work sessions and listen to the discussion, but there's generally no opportunity for public comment. Members of the public wishing to address the board are welcome to do so during the board's regularly scheduled meetings held twice monthly. We have 4 items on the work session today. We'll start with the agenda review. Any questions on today's agenda? Any questions on agenda going forward? Okay. And I know that I just heard from Commissioner Wakua, who is not going to be able to join us today. So it looks like it's going to be a small crew here. Commissioner Banks and myself to start with, at least. I don't know if anybody's heard from Commissioner Webb. All right, we'll go ahead to the next item, which is the Oregon Film Museum expansion tourism promotion funds request on page 2. And Monica Steele, our Assistant County Manager. Monica.
Thank you, Chair, Commissioners. Happy New Year. So today what I am bringing before you all is, are you able to hear me, Chair?
I am.
Oh, okay. Um, uh, so in your packet, you will see, and we've had this conversation before, and it's part of the reason why we recently extended the Film Museum's lease of the Goonies jail. So that way they had better opportunities for applying for grants and seeking long-term funding. And they acquired property several years ago, just diagonally across the street from the old jail to expand their film museum. And there is in your packet an image of what that expansion is proposed to look like. And they are in the process of seeking $10 million in capital funding. And I believe that they have approximately $6.5 million or so that they have raised to date. And they are looking to, they're requesting some funding from the county through our tourism promotion dollars to help meet a matching grant that they are applying for. And so what they're asking for is $225,000. And if this was something that the county board was interested in doing, it would come from the tourism promotion dollars. It is an allowable expense. And we would recommend that this be over a 3-year period in an amount of $75,000 a year. So that way, should there be other projects that the board chooses to use tourism promotion funds for, we have the flexibility for other projects as well. And so I am happy to answer any questions that you have. This expansion is going to include, it's going to be approximately 10,500. It's going to be 2 stories. It's the Oregon Film Museum, so it's going to, of course, focus on the films filmed here in the Astoria region, but also the state of Oregon. It's also going to be a learning opportunity for how films are made. They'll have exhibits that rotate similar to the Historical Society as well as the Maritime Museum. So that way they can help promote educational opportunities around film production, filmmaking, animatronics, I think is how you say it. So those sorts of things. And so happy to answer any additional questions that you all might have.
Yeah, thank you, Monica. Can you give a little background on the tourism promotion funds? What is our capacity with that annually, and where does it come from?
So the tourism promotion funds come from our transient lodging tax that we collect. It's a mixture of things. And so as you all know, we have the discretionary portion prior to 2015 when we increased the tax in the unincorporated area. And so we now most recently effective, sorry, I'm trying to think. I believe it was January 1 of 2026. We recently increased the county-wide tax amount. And so the 30% will continue to be discretionary, but then the 70% is tourism promotion per ORS. And the statute does allow things such as capital facilities, debt for construction of tourism promotion facilities. And a tourism promotion facility is something that attracts tourists, and a tourist is somebody who's traveling more than 50 miles in a day to come visit. The statistics for the Film Museum, I believe that they have on annually have visitors, over 50,000 visitors annually from not just the state of Oregon, but the US as well as internationally as well. And so the museum is a large tourist attraction. It's also a site that a lot of the cruise ship tourists come and visit as well when they come into town. So the benefit to those tourists is they're not impacting our road infrastructure when they come. So does that answer your question?
It does. And so if there is a legislative change to the formula with regards to tourism, this will be impacted, but probably not to the
Yeah,
extent.
so if there is a legislative change to those tourism dollars, depending on what that change looks like, it's more than likely that there will still be a portion that has to remain dedicated to tourism promotion. So this would not impact that, especially given that we are collecting that tax county-wide. So we'll still see a significant amount of tourism promotion funds.
Yeah. Thank you very much, Monica. Commissioner Banks.
I guess I just want to be or reiterate that the increase that we had on the countywide tourist tax was to address the 30% because we needed more funding in order to fund our sheriff's department. And what we're discussing today, and I think I'm just saying this for those listening, what we're discussing today is not that 30%. What we're discussing today is that 70%, where I feel like as a county, we struggle to spend that anyway. And so, having a request that will help bolster this agency that's requesting, I feel like is a good use of that funding. But I want to be very clear that the tourist tax that we so desperately need flexibility in is that 30% so that we can fully fund our our emergency response systems.
Yeah.
And so I think I'm just reiterating this for the folks listening, that 70%, we've always kind of, in my opinion, my personal opinion, we've always struggled to find relevant ways to bolster our community. And I feel like this is a very, very relevant way for us to bolster our community, while still remaining in that rulemaking of that 70%. And then I will, reiterate, I really hope that we achieve flexibility this legislative session so that we can relieve some pressure on our emergency response systems. So thank you.
Yeah.
Yes, so we do,
Go ahead.
sorry, go ahead, Chair.
No, go ahead, Monica.
So currently we spend, I believe it's approximately $125,000 annually on the tourism promotion funds with a contract with the Lower Columbia Tourism Committee. And so that's to promote tourism countywide. So we do use those dollars for that, but you are correct, Commissioner Bangs, given that we have recently increased the TLT amount. There is going to be additional funds, but this has nothing to do with the discretionary portion that is intended for public safety. This is strictly the tourism promotion, so that way we can continue to support those tourist-related economy and businesses.
Thank you, Monica. County Manager.
Chair Quilla, members of the board, if I just might expand a little bit and to say that when we increased the countywide rate, as Commissioner Bangs noted, it was really to address law enforcement fire challenges that we experience with tourism, which is why only the 30% can be allocated for those purposes. What we did anticipate is going through a planning process with our tourism related associations and with the cities to come up with strategies for that 70% that is now larger than what it's been because of the additional countywide rate. So we're going to work with our partners, but certainly the Oregon Film Museum is is very consistent with the notion of the tourism facilities dollars. And so we're going to work on a larger plan with our partners, but obviously this does fit in with that. And as everybody has said, and I'll just reiterate, this is not with the 30% that is totally dedicated going forward to public safety and our fire partners. Thank you.
Yeah. Thank you, County Manager. Commissioner Banks.
And I just want to ask, if we achieve flexibility at the legislative level for the 70-30 split, at the county, I am still interested in walking this back. And so what would be the impact to, say, giving this 225,000? Would that walking back that tax increase that we had here in January, um, would that impact this?
Chair Quila, Vice Chair Bangs, no, it would not. There's a sufficient amount with the 70% that even if the county walked back a portion of the rate, because it wouldn't be the full rate unless they gave us total discretion, which I don't anticipate. But certainly we would walk back the rate based upon the flexibility that the state does provide us, which is kind of what our commitment was when we increased it. So, but that would not impact this contribution.
And additionally, that's why we are looking at a 3-year contribution, not giving it all in a single year.
Thank you. I appreciate the additional context, important points. But I really think this is a good use of these funds. And certainly as someone who was just in the film museum last weekend or a couple weeks ago with the girls, it is the smallest little space and there's so many people funneling through there. It's amazing. So I think this is a much needed improvement, and I know that it will be drawing a number of people to the community, and I certainly support this expenditure.
So next steps, we will work on a contract with the Oregon Film Museum and bring that through the regular process. And just to reiterate, and it says that in the packet as well, they will continue to use the old Goonies jail as part of the Film Museum attraction as well. So they'll still be able to go in there.
Right. Well, thank you. Any other discussion? Okay, we'll move on to the next item, which is short-term rentals in floating residences. And Gail Henriksen, our Community Development Director. Welcome, Gail.
Yes, thank you. Good morning, Chair and Vice Chair. Back in July last year, we had a work session discussion with your board about allowing short-term rentals in floating residences in the Aquatic 2 zone. And the discussion was spurred by an application that had been submitted by a person who wanted to be licensed for another short-term rental in a second float house that they own. Both of the float houses are tied to one land use parcel, but the float houses themselves are actually outside the boundaries of that land use parcel. At that time that we had the discussion with your board, you directed staff to go back and look at regulations that other jurisdictions may have regarding short-term rentals and floating residences. So we did complete that. We did a survey of the cities of Scappoose, St. Helens, Portland, and then Multnomah County and Columbia County. And those results from that survey begin on page 11 of your board packet. Basically, the city of Scappoose does not allow short-term rentals in general, so they did not have any regulations.
Gail, can I stop
yeah.
you 1 second? I think Commissioner Webb is in the attendees. I think she needs to be promoted to a panelist if she could that can happen, please. Anyway, go ahead, Gail.
Oh, okay. Thank you. So, as I said, the city of Scappoose does not allow short-term rentals. Columbia County allows them, but they have no rules covering either short-term rentals or floating residences. Multnomah County takes a bit more of a hands-on approach. They do allow them. They're regulated through home occupation regulations. They have very specific limitations if the floating house is in the National River Gorge scenic area. City of Portland and St. Helens also allow short-term rentals and floating residences. They also have amended their local codes to address floating homes using their local building codes because the state building code does not cover floating structures. And so if you came in and wanted to do alterations, structural alterations, you would not have a requirement to get a permit. There's no state building code that requires it. It has to be regulated at the local level. I know that the applicant has submitted some additional information following our July work session, and I just wanted to address one of the items that they raised in their letter to the board that was provided to you.
Gail, can I make one
Yes.
one
Yeah,
other
sure.
interruption? I think that county council is also needing to be promoted to a panelist.
Okay.
Okay, go ahead,
Okay.
Gail.
Yep. Sorry. So in their application, I just want to point out and discuss a little bit the difference between a legally established land use parcel or a lot and a tax lot, which is created for taxing purposes. And so while the decision and the direction from your board will be for something that may affect a much larger group of people, I just wanted to point out this distinction with regard to this one particular applicant. They do have 3 separate tax lots that are for personal taxes, personal property taxes. One is for the floating home, that's address is 92973 Jack Creek Road. One is for the floating home, address is 92977 Jack Creek Road. And then they have a floating recreational cabin that has not been assigned an address yet. So each one of those has a separate tax lot number for personal property tax purposes, and they are all tied to the one land use parcel. And I call it a land use parcel, even though it's completely in the water, but was created by partition. And so just to point that out, their waterway leases are all outside the boundary of that, but they are tied to that one parcel. So we provided several different paths forward for your board to consider. One being just to leave the code as it is. There is one short-term rental right now that is licensed in a float house, and that was established prior to the adoption of Ordinance 2205, which added short-term rentals to our zoning code. The zone AC2 is not included simply because single-family dwellings are not generally permitted in that zone. So that one is grandfathered in. As long as it continues to operate, it will be able to be relicensed and renewed. But going forward, we would not allow any others. So that's one option for your board to consider. A second option is to go ahead and direct staff to make code amendments to allow more than one short-term rental to be tied to a land use parcel in a floating residence. It's going to take some code amendments. We would want to make that clarification in the code that having 2 float houses tied to a single land use parcel would be allowed. Right now, we only allow 1 STR per lot or parcel. And we want to make it very clear that if you have a land-based short-term rental and you have your home and an accessory dwelling unit, that you could not now come in and just create a tax lot around your accessory dwelling unit and request a separate short-term rental permit. We need to make some changes to the code to address parking. Right now, all the parking is required to be on site, which is obviously not going to happen with a floating residence. So we need to make an exception for that in the code. We would need to change the zoning code to also add short-term rentals to that particular zone as a permitted use. And then finally, staff would also recommend that we update Title 15 of the county code, which is our local building code, so that we could require permits for structural alterations, construction of new decking and walks and porches, just to make sure that they're meeting the same requirements that you would find for a single family residence. Really then, we put together a lot of information for your board that's in the packet, but really we're here to get your direction and answer your questions. And depending upon your board direction, we will either go back and do additional research. We could leave the code as it currently stands, or we could begin preparing any amendments that might be required. And if we do have to go through the code amendment process, then we estimate it's probably about a 4 to 6 month process. And I'm happy to answer any questions. Thank you.
Thank you, Gail. Can you just again reiterate what is the distinction between a short-term rental and a long-term rental?
A short-term rental is less than 30 days, and long-term would be 30 days, over 30 days.
And under the existing code, you can rent for 30 days or more.
Right.
Okay. Commissioner Banks?
I guess when we first established short-term rental rulemaking here, it's been so many years we've been talking about this. So my memory could be a little bit fuzzy. But if I recall correctly, when we were creating our rules regarding short-term rentals and caps and so on and so forth, that the only thing that I remember being potentially impacted in my region or my area was farm forest. And I didn't realize or I didn't recognize that a potential impact would also then be this float house situation that we have on the John Day. And so, or potentially the Columbia, but I mean, I think we're discussing the John Day right now. And and so I guess my perspective is how can we get this to a yes? I don't want to continue limiting economic growth, economic development, or rule make ourselves out of a way for a family, a landowner to be prosperous. And so what is the easiest method for county to get this to be a yes for the family, without further rulemaking ourselves into potentially another unintended consequence, if that makes sense.
I guess my comment would be it seems to me that this is a little different than a normal uh, dwelling. I mean, a float house or a float house is they have some unique characteristics, and certainly, you think of parking and then all of the utilities, and there's a lot of things that are unique to a houseboat or a floating home. And I do know that there's many instances where houseboats, floating homes have been used as long-term rentals. And I know that some of the examples given here are to folks that are working in healthcare that may be here for a short period of time, but I don't believe any of them are here for a weekend. I mean, in most cases, they're here for over 30 days, and that's still allowed. So my concern is that we are kind of opening up a can of worms by allowing short-term rentals on all of these floating structures, and then where do you draw the line about the area? I mean, it would seem that we're trying to do something more standardized for the entire county. So if we're just limiting that area to John Day or to some of these other locations, I think that's going to be another slippery slope. So I guess those are my kind of thoughts initially. I know Commissioner Webb has joined us. Commissioner Webb, do you have any comments?
I'm sorry. Can you am I communicating?
Yes, we can hear you.
Oh, okay, thank you. I'm having computer issues today, but I've been hearing you. And actually I agree with you, Chair. Um I I just think that opening this up we have a lot of potential places in this county where people could put floating homes. And so I guess I would ask for our staff to do a little bit more investigation about. Now, I'm assuming, Gail, that the what are we calling it? The AC2
Correct.
zone is we have that identified. I mean, how many different AC2 zones do we have in the county? Do we know?
Well, there's only one AC2 zone, but it's applied to several different locations in the county. So it covers the John Day River, portions of the estuary, Lewis and Clark River, Youngs River, and there's a small portion of the Nehalem River down on the south part of the county. It also covers several of the sloughs out in Commissioner Banks' district, Blind Slough, Warren Slough,
Mhm.
and areas like that. And all total, we have, according to our wetland, not wetland, waterway inventory, we have 49 floating residences and 38 recreational cabins, which are both classified as dwellings, floating dwellings.
Mm. Oh, so we do. We have that knowledge. In other words, we're okay. And
Yes.
and how many individual parcels are there? Do we know?
Most of them are not individual parcels. Most of them are just waterway leases through Department of State lands.
Uh-huh.
In this particular case, the owner actually owns a parcel created by a partition, but it's all in the water. It's not actually on land. It's a water parcel. Their floating structures, though, are outside the boundaries of that actual parcel.
Okay, thank you.
How would parking be handled in a situation like that?
Yeah, so there would have to be a lease if you did not own an upland property adjacent to it. If you own the property, upland property, then you would still have parking there and it would just be considered off-site parking. But we'd have to make that language available in the code so that people could take advantage of that.
And Commissioner Banks can speak probably to this better, but I mean, isn't parking at a premium as it is for a lot of these floating homes? I mean, I think a lot of times they're parked along the road when during duck season. And I mean, I worry about if we're opening it up to short-term rentals and then you have multiple vehicles all the time, that could be an issue. Oh, Commissioner Banks.
So I guess when I'm zooming out to look at this from the 500,000 foot level, if somebody is paying property taxes or taxes on two lots, I guess since we haven't reached the cap in that area, I feel like they should be able to utilize their property in the manner for which they wish to utilize their property. And that's me at the 500,000 foot level. Um, and so in regards to parking, it just depends upon the plot size, the adjacent land there. I mean, when it's duck season and it's duck shacks, there are no rules to my knowledge on if there's parking spaces. Those duck shacks fall under an entirely different. I don't even know if we have land use code for duck shacks. Anyhow, I do know though that the conversation regarding the duck shacks along the Columbia versus the John Day versus the slough. It's different conversations. But if somebody, in my personal opinion, is paying taxes and they haven't reached the cap in the area, they should be able to utilize their property for which they so choose. That's just a personal opinion. And so I guess that's why I want to explore this opportunity so that they can utilize their property for which however they choose.
Commissioner Webb, did you have any additional comments?
Um, I think that when I first of all, as usual, I'd love to commend our staff report because I felt it was really, really very thorough. And I'm not sure I have it memorized. I just have to keep going back and looking at the specific issues. Um, but I do think it's important for us to do this right the first time. And I'd rather see the staff, do a little bit more. Um, uh, I don't know, Gail, how do you feel about the whole issue? I mean, how comfortable are you in recommending, what we should be doing? What would you like to see us do?
Well, I can't tell. I really can't answer that question. We are here as staff to do what your board would see as fit policy, and so to make that happen in the best way that we can.
I think to Commissioner Webb's point, though, that this will be a big project in order to come back to us in 6 months with these revisions. So I do think we need to be strategic in how we're doing it. So I think Commissioner Webb, you're right. I would like to hear from our other commissioners, Commissioner Thompson and Commissioner Wakua as well, about what their thoughts are about moving forward. So I guess my thought would be to kind of table this until another work session and have our other commissioners weigh in as well, because I have hesitations about going down this road just because I think it's opening us up to a lot well, I mean, a lot of staff time and then also to a lot of future consequences. Commissioner Banks.
As we're sitting here talking about potential future consequences, I do feel like that some sort of rulemaking may need to be achieved just because one of the unintended consequences that we explored when we were exploring the short-term rental conversation was when we had short-term rentals in the community that were unregistered. And if we don't address rulemaking it potentially could leave us open to a lot of unregistered short-term rentals that are operating without oversight, safety concerns, so on and so forth. And I mean, the AC2 zone, I understand but if other agencies are addressing it, like Multnomah County, I feel like in some way we need to address it too. And we've already kind of set a standard for allowable use. And so to try to walk back that standard of allowable use just doesn't sit right with me. And so I think I would love staff to explore any potential unintended consequences that we may face if we pursue rulemaking in regards to short-term allowable use of short-term rentals in AC2. And in that way, we can kind of forecast and then decide. But I'm always going to fall back onto um, it looks like other agencies have created the wheel. We don't need to recreate the wheel. We have created a allowable use premise already by already allowing a short-term rental in AC2. And we haven't reached the cap in this region. And so those are just my thoughts. So thank you.
Yeah, thank you, Commissioner Banks. Yeah, and reading the report, I was surprised to see the other jurisdictions that do allow STRs and floating residences. So that was kind of surprising to me. Well, how do we feel about bringing this back at a later date and continuing this discussion with our fellow commissioners as well? Okay. Yeah, thank you, Gail.
Okay, thank you.
And then next item is Clatsop County Community Health Needs Assessment. And this is on page 21. And Jill Quackenbush.
Good afternoon. Am I going to be able to share if I have permissions? Looks like I do.
Yeah. And I'm sorry, I didn't give you your full title, Public Health Division Manager, Jill Quackenbush. Thank you, Jill.
Okay. Are we seeing that?
Yes.
Okay, thanks. So good morning and Happy New Year, Chair Quayla and members of the board. Again, Jill Quackenbush, Public Health Division Manager for the record. And I have with me Chris and Jason from Columbia Memorial Hospital and Providence Seaside Hospital. I'll let them introduce themselves, and also want to say publicly congratulations to Jason on his new position, and we can remove the interim title there. But I'll let them go ahead and introduce themselves.
Jason, you want to go first? You got the big new title. I mean, I don't know.
I know I feel weird. I didn't put a jacket or tie on, Chris. I didn't know we
You're
didn't
the boss
coordinate that
now,
we were
Jason.
gonna.
You can do whatever you want.
Oh, that's true. Good. Thank you. So Jason Plamondon, the new Chief Administrative Officer here at Seaside Hospital.
And I am Chris Lehman. I am the Vice President of Strategy for Columbia Memorial.
Well, welcome to both of you, and congratulations, Jason.
Thanks, Mark.
Jill?
Yes. So today we're here to share with you the results of our 2025 Community Health Needs Assessment. This was conducted from March through September 2025. We contracted with Heidi Bear 2 Consulting, which you've met before. We also worked with her on our Youth Prevention Needs Assessment. This is the second Community Health Needs Assessment collaborative we've done. Public Health Clatsop County has done with both hospitals through the Rural Health Coalition. And we'll talk to you also about our plans for the Community Health Improvement Plan. Jason and Chris, do you have any other comments?
No, I think the only comment I would make, Joe, is just that this the collaboration between the three organizations really allows us to have such a better depth of the community health needs assessment. And as a hospital, it helps us really engage better with the community by using some of the public health connections. So it's been very great collaboration.
Yeah, I agree with Chris. I think and this year I'm really excited because I think this is the first time, we've done the community needs health assessment in partnership for years, but I think this is going to be the first time, and correct me if I'm wrong, Chris, that we're going to, as a coalition, we're going to look at those priorities and what can we do as a coalition because now more than ever with the direction things are going with healthcare funding, we've got to start collaborating as a community to support those in need. So I'm excited.
And just a little bit about the Rural Health Coalition. This has been one of our recent activities. The other focuses of the Rural Health Coalition has been around transportation for substance use disorder treatment. This is a list of our charter members. One of our goals for 2025 is to look at our charter and update it. It hasn't been updated since the inception of the Rural Health Coalition. Again, you guys, Chris, Jason, any other?
Yeah, I mean, I think that the thing I would say about this is, and the group the commissioners know that this came out of the COVID pandemic and our partnership around testing and vaccinations. And I don't know that we've recently shared with the board the incredible things that have gone on, but like getting patients into treatment for substance use disorder, our numbers have gone up significantly. I mean, so much that, I think we could publish a paper or something about the great work that has gone on at the coalition. And we've got a great plan over the next few months to develop, the goals for 2026 and beyond. But other counties are calling us now about the work that we have gotten accomplished through the partnerships with the Rural Health Coalition.
Yeah, I think like CODA has been attending, and they said that they noticed a drastic increase in folks accessing their services, and they said the only change that they made was their connection to the Rural Health Coalition. So they really attribute that to the partnerships and the collaborations through this group.
Wonderful.
So a community health assessment is a structured way to understand the community's overall health, identify unmet needs and service gaps, and guide plans to improve health and well-being. There's a recommendation for local public health authorities to conduct a community health needs assessment every 5 years to meet the statutory requirements of public health modernization. And then the hospitals have an IRS requirement. And if you guys wanted to explain any of that or expand on that.
I would just say that historically the hospitals have both done our own, kind of in our own vacuums, and I think the health department has done their own. So I think these last two assessments, doing it together, it just makes it so much better.
Yeah,
I agree.
And then I just want to give a quick recap of public health modernization. And I know you guys have seen this slide before, but it's Oregon's governmental public health response through the elected local public health authorities to ensure that people are protected from disease. These are the foundational programs up at the top: protected from disease and environmental risks, prepared for emergencies, and that well-being is promoted. And then doing the community health needs assessment meets the foundational capabilities of assessment and epidemiology. So collecting data to inform and monitor governmental public health response. But you can tell, I mean, even though that might be the main one, like it takes in all the other foundational capabilities as well around leadership, health equity, community partnerships. We couldn't do this without our community partners, planning, communication, and preparedness. So our assessment process, again, we worked with Heidi Beartooth Consulting. We conducted 11 interviews with community leaders. We did 6 focus groups, 4 in English, and 2 of those were in Spanish. There was a data workbook that was the 3 entities were able to pull their quantitative data together for that. And then a community survey, which we collected around 600 responses for that. And there was a multitude of partner organizations that supported the report. Again, we can't do this without, this is really about hearing and listening from the community. So from school districts to chambers, senior center, colleges, Clatsop Community Action, CHART, CEDAR, Consejo Hispano, the CMH, Hispanic Patient and Family Advisory Councils, and again, yeah, the school district. So it really was a community effort. Any other comment? So I like to start with the ending, right? Because this is what people want to know. What were the priority health needs? So these were the 4 things that came up were the social drivers of health, mental health and behavioral health services, access to healthcare, and healthcare for Spanish-speaking population. So really, you know, not a big surprise, but again, these are the themes that we just continue to hear over and over again. And so looking at the social drivers of health, the places that we live, work, learn, play, and shape our health. And it's crucial for us to understand the local conditions because we want to ensure that everybody has the same ability to live a healthy life. And it's the idea that place matters and that our surroundings shape us. Key informants highlighted a vision for a healthy community, included a sense of belonging and trust within the community. So that 40%, that social economic was really important. Access to healthcare, economic stability, and meeting basic needs as the foundation of a healthy community. Generally, survey and focus group respondents reported that the community is a good place to raise children and a good place to grow old. However, there were some noticeable themes that regarding access to healthcare, housing, transportation, income, childcare, and food security. So taking a little bit of a deeper dive into that. So food security and hunger are closely related, but food security is the lack of available financial resources for food at the household level. And so that's kind of how it's defined. We know that only about 20% of the survey respondents reported that they felt healthy food was available in their community. And if healthy food, if affordable options aren't accessible, folks are going to tend to eat what's most available or cheapest. So it's usually processed food, high in salt, sugar, fat, which can, of course, lead to things like diabetes and heart disease. In 2024, just a little bit about our WIC program, we served 30% of pregnant women in Clatsop County. And that doesn't include those that were eligible that did not engage in the WIC program. That's just 30% of who we were able to serve. And then with childcare access, we know that childcare is a priority on the county's strategic plan. It's also a priority of our public health equity plan. 27% of the survey respondents felt that more affordable childcare options were needed in Clatsop County. The average two-child household spends 34% of its income on childcare. And the average cost of infant care in 2024 was almost $1,600 a month, $1,600 a month. And while Clatsop was removed from a child care desert list for 3 to 5 year olds in 2023, it was about a year earlier, less than half of the needs for children under 5 were met in 2022. And
Jill, is it okay if I say something about childcare?
absolutely, yeah.
Okay, so can I share my screen? Is that possible? Because I think it's important for us to talk about how the results of community health needs assessments impact things going forward. Because I think not only the county, but CMH and Providence both request. Oh, perfect! I am going to get to share it. Made childcare a goal, and that was why the task force on childcare was created, and why I mean, I feel like CMH and Prov both played big roles in childcare. So in the 2022 Community Health Needs Assessment, only 28% of so we didn't have a state average. This shows Clatsop County and Columbia County because this was done together. And then this shows Clatsop County and the Oregon state average in 2025. But you can see in 2022, in Clatsop County, only 28% of the children 3 to 5 had access to childcare, and that has since gone up to 50%. That's based on all of the work that our organizations, not only the county, but also the private employers in the county have done to improve access. And we still have a big problem with 0 to 2, and we're well below the state average. But if you look 3 years ago, only 7% of the 0 to 2 year olds had access to childcare within the county, and now it's up to 17%. So while we still have a long way to go, I just wanted to call out that based on our assessment last time, we all were right in front of us how big the problem was, and we were able to make some significant improvements based on the data that came from this assessment.
I think that's a good point. It's important to celebrate the progress that's been made. And again, great work, Commissioner Bangs. You can certainly take a pat on the back for all your efforts in that. But it really has been a great collaboration. And yeah, that's a great illustration of what the last 3 years, the progress that has been made. Jill?
Back. Wait, am I back there yet? No.
Not yet.
Sorry, Jill, I disrupted.
That's okay. This is my biggest anxiety, right? Like, is making sure that, is it showing? No?
While we're waiting, can I interject something?
Yes, Commissioner Banks.
I just want to celebrate our local industry getting involved in the childcare issue, mainly just because when we dove down this rabbit hole, I saw industry as one of the legs of the stool that's going to help hold up childcare. And the families can hold up a portion. Our local industry is holding up a portion, and hopefully we'll be able to tag in additional supports from other locations. But I appreciate both hospitals uh, diving into this rabbit hole with us, and I love seeing the measurable result. So thank you.
And Jill, we can see your screen. I did want to let you know I have a hard out in 20 minutes, so no need to rush through though.
Okay.
This is all good.
Okay. Are we back there?
Yep.
So the other highlight was around healthcare and provider access. That one of the number one reasons that survey respondents reported for not receiving care was they couldn't get an appointment soon enough. We also heard a lot about concerns with needing to travel for care and safety on access to the highways. I do want to point out here too that there's two things for clinic is not open when I can go. We did we did get that fixed. Wasn't fixed in time for this presentation, but the correct one is the 14%. So the correct one is the one in blue at the 14%. And then also just looking at some of the ratios around the number of providers available per residence. And Chris and Jason, this is really kind of your bailiwick. If there's any other things you want to share quickly.
I mean, yeah, I think it's a pain point for both of us, both hospitals. We're working on recruiting. It's a priority for Seaside. I'm sure it is for CMH as well. We know that there's so we're working on that. How can we be more efficient and seeing more patients, and then how can we draw more talent down here to help our county? So,
Commissioner Banks.
I just want to highlight potentially in the future as we go through this again, because we'll probably go through this process again, if we could delineate out pediatrics, because I know that especially in the mental health field, pediatrics is something that is suffering in our local community. And so if we can call out pediatrics separately from adult care, that would be beneficial, I think, for me as a commissioner, but also for our community.
Thank you. It's good feedback. So mental health and behavioral services was also one of the top themes. Overall, survey respondents reported more anxiety and stress in the past year. I do want to note that our Spanish-speaking respondents to the survey reported their top one was feeling more depressed and feeling down. And then almost a quarter of respondents reported that they needed support for a personal problem or mental health condition, but didn't receive it. And just some, quotes from folks from the interviews and focus groups, but that financial and social costs, lack of providers, having to use telehealth services or travel outside Clatsop County were all issues brought up throughout the assessment. Focus group participants also discussed stigma when seeking help for addiction and mental health and lack of services for youth. To your point, Commissioner Banks, like that was brought up. And then finally, healthcare needs for Spanish speakers. We heard a lot about the quality of interpretation was a barrier to healthcare and that can lead to misunderstandings and reluctance to seek care. And I think this is a great graph from Columbia Memorial Hospital around their projecting for outpatient volumes of Spanish-speaking patients. And at public health, that we see about 15 to 30% of our participants are Spanish speaking. And we're seeing increases in the need for interpretation and translation services across all programs, including our environmental health program. Chris and Jason, do you have anything?
I think the only thing that I would add, Jill, is this is CMH specific data on number of visits, and I think it's interesting to look at. CMH has been really working with the Spanish speaking community to try and increase the number or improve access for members of that community. And when you look at volumes in the emergency department and urgent care, and over really the last 5 years in primary care, it's been going up, but in 2025, you saw that go down. And when we're talking to members of that community, what we're hearing is they're coming in when they have to, like for an emergency visit or an urgent care visit, but they're not seeking out the primary care just because of not feeling safe in the community. And it's not a CMH thing, it's more of like the political climate of the community and the country. And so Jill in a minute is going to get into cancer screening and some sort of chronic disease things. And it's so important to have people coming in for those primary care visits to really reduce costs in healthcare by getting them primary care and not having them wait until they need emergency services. So I just wanted to call that out, Jill, because you can see it in the data. It's having an impact. They're not coming in to get primary care.
Yeah, we're hearing the same thing from that community here. They're fearful of coming in, so they're only going to come in when it's emergent.
And I just, Chris, I did want to let you know those cancer ones didn't get put in here just because I knew of the time constraint. So so what's next with the community health needs assessment? So we'll be sharing the results with our community through social media, going back to the organizations and the groups that we worked with and doing this presentation for them. We do have a website. The Rural Health Coalition has a website, www.clatsophealth.org. We'll be uploading and putting this information up there. And then working with the Rural Health Coalition to develop a countywide community health improvement plan. So that's one of our priorities this year. I think it will be great to have, the ability of all of us working together on the shared priorities. Again, it goes back to what we were saying at the very beginning, is we can't do this alone. And so being able to work together to address the priorities. I also, along with our community partners, I also want to thank the assisting staff at CMH and Providence. So, we've kind of been there, but I couldn't do this without the help of those at Providence and Columbia Memorial and on our staff here at Public Health to be able to pull all this together. It was great to be able to contract with Heidi's group as well. But there's so much work that goes into these assessments, and I just want to make sure to thank all the staff at all three places that were involved.
Yeah, I completely agree, Jill. What an achievement to get this compiled and put together. And now I guess the real work starts in putting this in motion. Do we have any questions from our commission? Either for Jill, Jason, or Chris. Commissioner Banks?
I am curious, and it's kind of so that I have a sidebar to measure effectiveness. Do we actually know in county how many residents are Spanish speaking first as their primary language? I know how important it is to have fluent Spanish speaking, service providers so that there is relevant translation. into like, community needs. I mean, I'm pushing my own 3 children to be bilingual. But do we know, like, can we see our effectiveness by knowing how many in our community are primary first language Spanish speakers? Is that a question that we can answer? I don't know.
I think we can get to a decent guesstimate on that. Census data will tell us some stuff, but that doesn't capture all of it. One of the things that we like to look at is our school enrollment and the number of students that are in our English language learner programs, because that tends to show a more accurate, I think. Also, the census might not get our undocumented folks as well. But I can try to put some stuff together and have it sent out to you guys for sure.
Any other questions or comments? Commissioner Webb?
Um, I think I think that in addition, as a pseudo scientific statistician, that I do know that the data for rural issues is always more difficult than it is in urban issues. Even with the new ACS census continuous census work, we do know that in rural areas, the data is less dependable than it is in urban areas. And that's just a difficult thing that 20 or 30 years ago we thought our census changes were going to make a big difference, and they have, but they're not perfect yet in rural areas. And the other issue I think is the the prevalence now of a lot of online um, uh, statistics that are very questionable, and so they're just not as dependable, and it's difficult. And I know we go through this in our rural areas, especially for the transportation issues. And I wonder, Jill, to what extent did this research address the issues of the Sunset Empire? Have you all kind of met with them about demand for rural transportation services? Have they been involved in this? I know that with a lot of the staff changes and board changes there, I'm wondering how accessible they have been.
Yeah, that's a great comment and question, Commissioner Webb. And we have, with the Rural Health Coalition, so Sunset Empire Transportation District has been engaged and attending that, I would say in the last
Good.
half a year, 6 months, 3 months.
Good. Thank you. I think their involvement is really critical.
Yeah.
Good question, Commissioner Webb. Commissioner Banks?
I just am thinking back to the list of partners at the beginning of your slide deck. And I was curious if moving forward in the future, I didn't notice there if we had any individuals from kind of the more rural aspects of our community, like Jewel, Westport, Napa. I did see 3 of the school districts, but I didn't see all 5. And so just being that the unincorporated areas are going to have different stories than what you have within city limits. And so I'm curious if there's going to be a push to incorporate more stakeholders from outside of the municipalities.
I think that's going to be brought up as part of our community health improvement plan, is the need to engage some of our more rural areas.
Good.
Any other questions or comments? Jason, Chris, do you guys want to add anything?
No, just thank you for your time and letting us, and thank you, Jill, for doing a great job with the presentation.
Yeah, I was just going to echo what Jason said and thank Jill. I mean, it has been so great over the last 5 years. I mean, we've had this team that's kind of developed the Rural Health Coalition and kind of kept things going and together, and it has so much farther reaching effects than just an assessment like this. I mean, to be able to text or call someone and work immediately on big problems together, it's just been so great. And I appreciate Jill's leadership and all she's done to kind of keep things going and together.
Thank you, and I echo that as well. You both have been great to work with.
I think in talking with Chris in advance of this meeting, he was mentioning of what a great tool this is and how this can be used by other nonprofits and organizations for writing grants to be able to rely on this report and the data collected within it will be very helpful for them to leverage towards additional resources. So that was a really good point. Commissioner Banks?
Could we share this slide deck with all of our superintendents? I know that they're frantically seeking funding for a multitude of things. And so any agencies that we can think of that need it for grant writing, that would be great.
Yes, most definitely. And Commissioner Banks, we'll make sure to include that as part, as we are going to be going out to all the schools as a result of the youth prevention needs assessment too. So we will make sure that these are just hand in hand together.
That's great. Yeah, thank you, Jill. Really appreciate the presentation. Thank you, Jason and Chris. Job well done. We don't have anything else on our agenda, so we'll go ahead and adjourn. Have a good rest of your Wednesday. Take care.
Why can't I leave?